Bringing your child to the dentist for the first time marks an important milestone in their life. It's a step towards establishing healthy habits that will benefit them for years to come. The American Academy of Pediatric Dentistry recommends scheduling your child's first dental visit by their first birthday, or within 6 months of the eruption of their first tooth. This initial appointment is an opportunity for the dentist to examine your child's mouth, assess their risk for dental problems, and provide you with valuable guidance on oral hygiene practices. Early detection and prevention are key to maintaining optimal oral health throughout childhood and beyond. During this first visit, the dentist will gently examine your child's mouth, checking their teeth, gums, and jaw development. They will also assess their bite and look for any signs of decay or other potential issues. This early examination allows the dentist to identify any concerns early on, when treatment is often simpler and more effective. By making the first visit positive and comfortable, you can help instill good oral hygiene habits and set the stage for a lifetime of healthy smiles. Preparing your child for their first dental visit can help make the experience smoother and more enjoyable. It's natural for both you and your child to have some questions or even a little anxiety about this new experience. Rest assured, pediatric dentists are specially trained to work with young children and create a comfortable and welcoming environment. Before the appointment, talk to your child about what to expect. Use simple terms they can understand, such as counting their teeth or giving their teeth a little hug. You can even read books or watch videos together about going to the dentist. Familiarity can help alleviate any fears or anxieties they may have. Choose a time of day when your child is typically well rested and in a good mood. You can also bring along their favorite comfort item, such as a blanket or stuffed animal, to provide a sense of security. Let them know that you'll be right there with them throughout the appointment. As a parent, it's important to be aware of common dental issues that can affect toddlers and young children. Early detection and intervention are crucial for preventing more serious problems down the line. By understanding these issues and taking proactive steps, you can help safeguard your child's oral health. One common dental issue in toddlers is early childhood caries, also known as baby bottle tooth decay. This occurs when sugary liquids such as milk, formula, or juice are left in contact with a child's teeth for prolonged periods. To prevent this, avoid putting your child to bed with a bottle and limit their intake of sugary drinks. Another common concern is teething. As your child's teeth erupt, they may experience discomfort, drooling, and irritability. To alleviate these symptoms, you can gently massage their gums with a clean finger, a cold washcloth, or a teething ring. Over-the-counter pain relievers such as ibuprofen or acetaminophen can also provide relief if approved by your child's pediatrician. Gently brush your child's teeth twice a day with a soft bristled toothbrush and fluoride toothpaste, using a pea-sized amount. Choosing the right pediatric dentist for your child is an important decision. You want to find a dentist who is experienced, compassionate, and skilled in working with young children. A pediatric dentist has specialized training and expertise in the unique dental needs of infants, children, and adolescents. When selecting a pediatric dentist, consider their credentials, experience, and approach to patient care. Look for a dentist who is board certified and a member of professional organizations such as the American Academy of Pediatric Dentistry. These certifications indicate that the dentist has met rigorous standards of education, training, and ethical conduct. Consider the dentist's communication style and their ability to put your child at ease. A good pediatric dentist will take the time to listen to your concerns, answer your questions thoroughly, and explain procedures in a way that your child can understand. Ask for recommendations from other parents, your pediatrician, or your local dental society. For many children, going to the dentist can be an anxiety-provoking experience. The unfamiliar sights, sounds, and sensations can be overwhelming. However, there are steps you can take to create a positive and reassuring experience for your child, easing their anxiety and building trust with the dental team. Start by introducing the concept of dental visits in a positive light. Talk to your child about the importance of taking care of their teeth and how the dentist helps them stay healthy. Avoid using negative language or associating dental visits with punishment. Instead, frame it as an opportunity to keep their smile bright and strong. Role-playing can be an effective way to familiarize your child with the dental setting. You can pretend to be the dentist, examining their teeth with a toothbrush or a small mirror. Let your child take turns being the dentist, examining your teeth or a stuffed animal's teeth. Early dental care is essential not only for maintaining a healthy smile, but also for supporting your child's overall health and well-being. The health of your child's mouth is intricately connected to their overall health. Neglecting oral health can have far-reaching consequences, impacting their speech development, eating habits, and self-esteem. Good oral health habits established early on can help prevent cavities and gum disease, which can lead to pain, infection, and even tooth loss. These conditions can affect a child's ability to eat, speak, and sleep properly, impacting their growth and development. Regular dental visits allow the dentist to monitor your child's oral health, identify any potential problems early on, and provide timely intervention. Investing in your child's oral health is an investment in their overall well-being. Establishing healthy oral hygiene habits at home is paramount to maintaining your child's dental health. As parents, you play a vital role in instilling these habits from an early age, setting the stage for a lifetime of healthy smiles. By incorporating simple yet effective practices into your daily routine, you can make oral hygiene a fun and integral part of your child's life. Begin by brushing your child's teeth twice a day, using a soft-bristled toothbrush and fluoride toothpaste. For children under 3 years old, use a smear of toothpaste the size of a grain of rice. For children 3 years and older, use a pea-sized amount. Gently brush all surfaces of their teeth, including the outer, inner, and chewing surfaces, for 2 minutes each time. Flossing is equally important as it removes plaque and food particles from between the teeth, where a toothbrush cannot reach. Start flossing your child's teeth as soon as 2 teeth touch. Make oral hygiene a family affair. Let's face it, getting young children excited about brushing and flossing can be a challenge. However, by incorporating fun and engaging activities into their oral hygiene routine, you can transform this mundane task into an enjoyable experience they'll look forward to. One effective strategy is to turn brushing into a game. Set a timer for 2 minutes and challenge your child to brush their teeth for the entire duration. You can also create a reward chart, giving them a sticker or a small prize for each successful brushing session. Another idea is to let your child choose their own toothbrush and toothpaste. Reading books or watching videos about dental hygiene can also be both educational and entertaining. Nutrition plays a crucial role in dental health, impacting the development and maintenance of strong, healthy teeth. Just as a balanced diet is essential for overall health, it is equally important for oral health. By making mindful food choices, you can provide your child with the nutrients they need to build strong teeth and gums. Calcium is an essential mineral for strong teeth, as it helps build and maintain tooth enamel. Encourage your child to consume calcium-rich foods, such as milk, cheese, yogurt, and leafy green vegetables. Vitamin D is also crucial for dental health, as it aids in calcium absorption. Limit sugary drinks and snacks, as they contribute to tooth decay. Encourage your child to drink plenty of water throughout the day, as it helps rinse away food particles and neutralize acids in the mouth. As your child grows, it's important to celebrate their dental milestones and reinforce the importance of maintaining good oral hygiene habits. By tracking their progress and acknowledging their achievements, you can foster a sense of pride and ownership in their dental health. Keep track of your child's dental visits, noting the dates and any recommendations or treatments received. This record can be helpful for monitoring their oral health over time and identifying any potential concerns early on. You can also create a dental chart at home, allowing your child to mark off each successful brushing and flossing session. Positive reinforcement goes a long way in encouraging healthy habits. By making dental care a priority and celebrating their milestones along the way, you can help your child enjoy a lifetime of healthy smiles and optimal health.